Print for healthcare in the Northwest needed to reflect the realities of our region, as well as the best current thinking here and in jurisdictions across the country. To that end, a thorough study was conducted by PricewaterhouseCoopers to evaluate our current healthcare system and to predict the system's needs in the future. The study included a detailed look at our current services, projections of future demands and needs, mapping the current and ideal patient journey, and input from stakeholders and providers. All of this information was shared with some of our health service providers and other stakeholders who provided valuable feedback to the findings in the report. The information and data collected in the study makes a very strong case for change. The study found that the Northwest LHIN has a high rate of preventable disease. For example, according to statistics, in the Northwest, more people smoke, drink heavily, and are overweight compared with the provincial average, contributing to risk factors for certain chronic diseases. 25% of people over age 65 have diabetes versus around 20% provincially. 58% of people over age 65 have high blood pressure versus around 51% provincially. 23% of people over age 14 have arthritis versus 17% provincially. Transitions between care settings are not handled efficiently and effectively. There are still many instances where patients have to wait in hospital until home care or long-term care becomes available. Those patients who are sent home don't always receive the proper support and follow-up in the community, and as a result, they often end up back in hospital, especially for conditions like heart failure, chronic obstructive pulmonary disease, and diabetes. The Northwest LHIN has very high rates of readmission for these conditions. Patients with chronic diseases could be managed much more effectively in the community. For example, the rate of major amputations for diabetic patients in the Northwest is over 2.5 times the provincial average. Northwest LHIN area residents have high rates of hospitalizations and emergency department visits for many chronic diseases, suggesting the need for community-based services like primary care through a family physician, nurse practitioner clinics or walk-in clinics, or other community-based programs. The Northwest LHIN has the highest rates of acute care hospital use in the province, and this rate could be as much as 40% lower. The number of repeat emergency department visits by individuals is 28% higher than the provincial average. Patients are visiting hospitals for health issues that could be treated in alternate primary care settings in the community. In the case of small, remote communities, however, this use of acute care might be more appropriate where few alternatives exist. Healthcare costs are higher in the Northwest LHIN, while our share of future healthcare funding is expected to decrease. In 2009-2010, our healthcare spending was 39% higher per capita than the provincial average in almost every sector. We have a large rural and remote population that has challenges accessing the same services that are available in larger centers, and helping people meet those challenges is expensive. Forecasting shows the demand for healthcare services in the Northwest in the future is expected to increase in all sectors, especially for services associated with care for the elderly. Meanwhile, population growth and the growth of healthcare services in the Northwest are expected to be lower than in other parts of Ontario. Given the funding model used by the province, this may result in a smaller share of healthcare funding for the Northwest LHIN in the future, meaning we need to make the best use of our existing resources. More than 95% of all healthcare services used by residents of northwestern Ontario are accessed right here in the Northwest LHIN. This clearly shows that people in this region can and do rely on their local healthcare system, which is why we need to ensure that it is the best it can be for generations to come. Interestingly, very few people use most of the services. Just 1% of the Northwest LHIN's population uses 50% of the total hospital and home care services.